Thank you very much, Mr. Chairman. Dr. Altman, I'd like to begin with you. I very much appreciated your testimony talking about the positive impact of AI on accelerating drug discovery, improving diagnoses, and also allowing more time for interaction between the healthcare provider and the patient. An issue that I do want to ask you about is the impact of AI on hospitals, particularly our rural hospitals. In my state of Maine, many of our hospitals are facing severe financial constraints, and rural hospitals in particular are teetering on the brink of closure. Dr. Ed Kimlin, who is a medical director at Maine Health, the largest hospital in our state, recently wrote that AI is not a luxury but a lifeline for hospitals with razor-thin margins. In his opinion, AI is allowing clinicians to recover time otherwise spent on administrative tasks, a point that you made. And he talked about how he used to spend an hour crafting appeals to fight denials by insurance. With AI, he spends 10 minutes, and he's been able to get better results. Could you talk about what the potential impact for a smaller hospital of using AI might be?
Yes, Senator, thank you very much for that question. So you're absolutely right that AI in small rural hospitals is both an opportunity and a problem. It's an opportunity in the ways you just described. They are resource limited, and sometimes the expertise, and especially for specialized areas of medicine, is not available to them, so that the idea of a vetted, well-done AI tool to help them bridge the gap for patients that maybe need to be transferred or that they want to try to keep at home for multiple reasons is a real challenge. And so AI does have the potential to help those hospitals keep their patients near their families at home and while providing expert-level care. The challenge is that these hospitals are being inundated now with apps from well-meaning, for the most part, companies that have built these apps, and they need help to vet them. They need to make sure that these tools are going to be appropriate for the population that they serve, that they are based on the appropriate and up-to-date evidence. And there is where it's just a lot to ask a small rural hospital to have an AI czar. They can, they need to keep the trains running, so to speak. And so this is why the idea of having some sort of a body, either in the private sector or a public-private partnership or something, where best practices are laid out, where tools get some basic vetting for accuracy, utility, and to also create guidelines so that motivated physicians or leaders at the hospitals can look at these tools, understand their features, match them to their population, and decide if this is a go or a no-go. And then, of course, they have to figure out how they're going to pay for this. And I'm not an economist, and so I'm going to just acknowledge that as a big issue. So to keep it short, I think that this is a great opportunity to extend the capabilities of rural hospitals, but I think they would tell you right now that they need help in vetting these tools, and right now it's a tsunami that they can't manage.
Thank you very much. Mr. Bailey, I want to follow up with you on the role of AI in our schools. In your written testimony, you cited a study from Turkey that illustrates the problem all too well. Students in that study saw an incredible 127% increase in scores when using AI, but when the AI was taken away, these students saw their scores decline 17% compared to students who had never used the tool. So how can we ensure that the use of AI will actually improve student performance rather than cause students to be excessively reliant on AI and not learn the basics?
Such an important question. And it's a complicated one, in part because even the study in Turkey, that was the initial finding. What they found is when they changed the prompt to push students more, some of that learning loss, the cognitive offloading was recovered. And so I think what we're learning is that just with the foundation models, you get this amazing ability to help engage students and help them understand concepts, connect concepts to interests and passions that they might have. But that's insufficient. You need really thoughtful prompts. You need these systems to also have alignment and be trained on additional science of learning, science of reading, other things that we know are the foundations for evidence-based teaching. And that through that fine-tuning, through that additional training, that's how you help address some of these other challenges. But it's also part of the reason why I suggest that we need more benchmarks. That right now, when ChatGPT 5 comes out or Gemini 2.5, we see all these benchmarks about how good it is at coding, how good it is at science, how good it is at different types of mathematical functions. We need education benchmarks that help test for the very thing that you're calling out there. Is it producing productive struggle, or is it just giving a very quick answer?
Thank you.